This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo! Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Hey everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist, and
I'm Janet Novotny-King. I'm the doctor's sister. I am in no way medically trained, but I'm here to help you pet owners love your pets a little more, know a lot more. So we love to have our guests on who provide science-based information so you can be a smarter pet lover like we are.
And rescuer. Yes.
Who do we have on today?
Well, first of all, I have to tell you, Janet, since I've been retired, I listen and watch a lot of podcasts and webinars. Mm-hmm. And as I told you before the show, very few really strike me as, oh my God, that was a really fun webinar. Guess what? Dr. Mary Gardner fits that category. And that is the ultimate compliment because I am the webinar queen of listening to webinars. Dr. Mary Gardner is a University of Florida College of Veterinary Medicine graduate. She is also
She's a gator.
Gators, that's right. She's also a founder of Lap of Love. And like me, she is an old dog, old cat lover and very passionate about their health and keeping them mobile and safe. And we were just meeting today for the first time, and I already feel that we have a big bond between us as a lover of older pets. But anyway, we're going to talk to her about mobility issues and what we can do to make our older pets, just like older people like me, more mobile and more comfortable. I do want to add that Dr. Gardner has published 9 Lives Are Not Enough, a book on cats. It's Never Long Enough, a book on dogs, and the treatment and care of the veterinary patient, which we will all have in the podcast text, okay, as well as some pictures that she's provided for us of how to make certain issues with your pets more comfortable. So after that long spiel, welcome Dr. Mary Gardner. We're so happy.
I didn't even say anything. That was perfect.
So let's start with, how do you know, you have your pets for so long, they're part of the family. How do you know as a pet owner when it's kind of, they're just starting that kind of geezerdom?
They're also like a jalopy, right? So now, Janet, are you asking me, because I want to be certain, because people ask me very particular questions, so I want to make sure I'm answering the right one. So are you asking me, when do I know that they're kind of geriatric and slowing down and they need help? Or are you asking me, when do I know it's time to say goodbye?
No. When do you know they're starting to kind of turn that senior corner, like they're going to get their AARP card in the mail?
So this is important, right? Because everybody asks me that second question, and I don't think we're there yet.
Yeah, no, we know. We've covered that one a lot.
No. So, and it's interesting that you bring up the AARP. So in humans, we've got this senior, this classification as senior, and same thing in dogs and cats, right? We call them seniors. But really, what is that, right? And who makes that rule? Mm. And really, senior in the human space, one could argue, is really 65. And that's mostly around when you would have your pension, retirement, or Medicare is 65. That has nothing to do with your health and your and how you are.
Right.
Now, the AARP targets all of us at late 40s, actually, and they'll start to send out material. Yep. And of course, when I get it, I'm like, oh, hell no, the same for me.
Doesn't apply to me.
I write on the envelope, wrong address, right, and send it back. But I'm 52, and so do they have the wrong address? Listen, if they got a BOGO and a deal for me, I'll take it. So
sure.
I'm all about it.
Coupon queen right here.
Right.
Buy one, get one free.
BOGO. Right. Do they have a car organizer that I can buy for $12? I don't know. But so really the term is really just a number. And that could be the same for our pets. And we typically say a dog is senior at 7. But are they Are they bad? Are they good? Right now, here's the problem, Janet, and Alice knows this too, is that not all dogs are the same at 7 because of their size. And there's a massive difference between a Great Dane and a Chihuahua and their lifespan. So it may be actually, 5 or 6 for a Great Dane or a jumbo dog. And at 12, you're still like in adolescence in some of these little guys. So they run around with horrible teeth.
Yeah.
But so that's just a number. And so typically we say 7 for dogs and 10 for cats. But the real question is when they become a geezer, when they become a jalopy, and when is that? So now let's go back and think about us. When do we become that? And that all it depends, right? How well we've taken care of ourselves, if we've been doing weight training, if we've been eating healthy, if we've not been doing X, Y, Z. Some of it's our genetics. And so there's a difference there. But generalities is that in the human space, there's something called a geriatrician. And I would love to be a geriatrician. I think that would be just to sit there with wonderful older aged people and just help them all day.
Yeah.
So that is typically the last 10% of a human's lifespan. So if we all want to make it to, let's say, 80, then, our 70s are going to be jalopies. That's our geriatric. And then there's something called the geriatric syndrome. But it really, to make it super easy for all those listening, is how fragile are we? And that's it. So when I see a dog, you can have a lab come running into your clinic at 10 years old. They got a little hitch in their giddy up. They got a little bit of arthritis, but they're okay. That same dog at 13, 14, with decreased vision, could barely hear anything, is incontinent, panting and pacing at night, has got those skinny, spaghetti legs, and they're weak and their muscles, are all weak. That's a different dog, and that's a geriatric dog. So those are my favorite. I love seniors, but that's just loving 50 and 60-year-olds. I like the geriatrics.
Yeah. True.
Boy, that lab description describes Anne's last lab.
Yeah. Yeah, our friend.
Totally, that you could feel in the hips, it was crunchy.
Oh yeah, the crepitus in the hip. But Dr. Gardner, you mentioned something. Let's talk about incontinence. I just lost my dear Capri. She was 22. Okay. She's a cat. And of course to kidney disease, which she was so brave and lived so long. But a couple of tips, and I know you'll be able to expound upon this, but toward the end, it was hard for her to lift her legs into the litter box.
Yeah.
So then we invested in crates of pee pads. And and I know I want you to give some tips on that, but the other thing, if you're going to do pee pads for a dog or a cat, an elderly cat or elderly dog, or a young dog that has pee problems,
or human.
Yes, or human, you've got to keep them clean back there. Because you have to do that. So could you please talk about incontinence? Let's start with that.
Wait, and one thing, by the way, one of our viewers told me, one of our fans, is that the human pee pads, those blue ones they put in the hospital, are cheaper than the pet ones.
Yep. And
that's true.
And it's the
some
same
are
thing.
washable. So
yes,
there's that. Yeah. Okay, listen, guys.
I thought that was
Incontinence could be a whole half hour, and I'm fine, right? Because we see it so often in our dogs and cats, and whether or not they have mobility issues or endocrine disease or whatever, we do see it, or it's old age sphincter problems, and but how do we keep them clean?
Or medication problems, or medication. You're on steroids.
Steroids, exactly. Lasix, for heart disease. Yeah. So how do we keep them clean? And also. And this is a big thing, is how do we keep our caregivers not from going crazy? Because
absolutely
support.
People,
it ain't easy. And everyone thinks, fecal incontinence has got to be better than urinary incontinence. No, it is if it's a nice little poop, but it's never a nice little poop, right? It's my dog Sam. She had diarrhea, and technically it was diarrhea, right, Dr. Alice? But it wasn't. But then she was she had mobility issues. Then she smushed it around, and she had long fur, and then it was getting in her fur, and then it was into the rug, and it was anyway. So Here's some tips. I'm going to talk about urinary incontinence and then fecal incontinence because both are really important. And did you know the number one reason why human caregivers send their human geriatric person into a nursing home? Number one reason is incontinence. It's so hard to manage. And with the humans, you're lifting them and things like that. So, Dr. Alice, your little kitty cat, that's kind of easy to move around. But like imagine a 50-pound dog. That's a tough thing. So with cats and dogs too, eventually you will move to the wee pads. But the lower the box, cutting down the wall so that way it's easy to get into.
Okay.
But honestly, just stepping over that amount is a lot. And I appreciate more now than I ever did what it like stepping, because in January, so just 5 months ago, I was roller skating and
Inline?
Quads, Janet,
Or
quads.
floor?
Okay, I'm an 80s girl.
You're dating yourself,
Yeah.
Janet.
Actually, the other way. She knew inline. So she's
Yeah,
an 90s girl. I'm an 80s girl. And some kid flew
Yeah.
behind me and clipped my skate. I flew in the air, landed on my lower back, and I actually have a massive transverse fracture across my sacrum. So it's not my tailbone.
Oh.
And they didn't know exactly. They all thought it was my tailbone until I got a CT a few weeks later. But I'm sitting on like a cushion right now. It's, I can't even describe. But
That's a geezer sign.
totally
Go
is.
on.
But
Push it.
you've got to go. You've got to go to Pilates.
Wait a minute. So let me tell you, Janet.
Yeah, wait.
Okay, so anyway, you're
I'm
sitting
sitting
on a
on like an
cushion.
air mattress right now, basically. But it's like
Donut.
a hemorrhoid donut.
Donut.
Let's be real. So the point of this, though, ladies, is that I couldn't even like step over the curb. Right? It was like, ugh.
Right.
I wanted the ramp. I never wanted stairs. Even now, 5 months later, stairs hurt. So I'm like, oh my God. Like, I get it, how bad it hurts. So that getting in a litter box, getting up a step, like, and if you think about what's the word? Like, it's 50% of their height that they've got to walk over, right? The ratio.
That's right.
The ratio.
Yeah,
I'm 6'1", and there's a 4-inch step, and I was crying over it. Can you imagine being a 12-inch cat having to step over something that's 8 inches, right? Like, forget about it. So,
Okay, Dr. Mary, confess your sins. Did you have to get the raised
No.
toilet?
you know why, Janet? Because I already have a raised toilet because I'm so tall. I got
Extra credit.
so I'm already there.
You know what?
Yeah.
I was on crutches once, and you're right. You notice things like
Yes.
curbs.
Right.
Because I'd be like, oh my God, I can't go that way. There's a curb.
So many people, when something has happened to them, then they have more sympathy for their pet.
100%.
In this,
100%. So the wee pads are great, but here's a little trick though, is that there is like on Amazon, I've got like a whole Amazon shopping page because I find things, I just store like.
Oh, good. We have to put
yeah.
that on the
And
tip.
I just collate all of them. I'm like, well, that's a cool product. I just put it there.
Yeah, I'm
And
gonna write
it's
that down.
it's a wee pad holder. So you put the wee pad in this little, it's like a clamshell and it holds it in place. So they don't. It's like it's a half an inch tall, right? It just holds it. It's a tray. It's a tray, and it holds it there because when they're coming in and maybe it slides, so it keeps it in place.
Yeah.
And that's for dogs or cats, right? And so.
Okay, wait. I gotta know. What other tips do you have for older pets? There's got to
I
be a
have
bajillion.
that's with my books. They're all in my books. But
Yeah.
'Cause I got to tell you, I love a yoga mat in the back of the car on the plastic thing because then they
so the yoga mats. So there's also a company called YogaDirect.com, and they sell yoga mats in giant rolls. And so you could get rolls, and you're gonna have to cover your whole house. And Janet, the back of the car for sure. Everybody has those, plastic things, but those are slippery. So yoga mats, or bath mats, but you got to have bath mats with the rubber bottom, not like slippy ones that you get at like a hotel. So you've got to have the rubber mat. There's also I love the jigsaw puzzle piece gym mat.
Yes,
For kids.
kid thing.
Play mat. So that's good too. And you can go to like Goodwill and stuff and get a lot of these things if you find them cheap. But so now back to the
Yes.
incontinence, because I got two more important things.
Yes.
There's a speaking of good, Salvation Army and stuff, getting children's like baby mattresses, because they're all like truly waterproof, right? You can get these mattresses for your dog, but they're hard.
Yep.
And then the other, hold on, I got three. So that one. Then also, if you do have a really nice dog bed and they're peeing in it, or a little cat bed,
Yeah.
get a baby mattress cover, a fitted sheet. It's a fitted cover.
Yep.
Because they're plastic on one side and nice and cottony on the top.
Yep.
And you just get like 5 of them and just wash them and rotate. So you just cover your dog bed. So I had a Doberman, so my dog bed is massive. And I was sitting there like struggling with the dog bed, and he was on Lasix, which is heart medicine, and he was peeing a lot. And so I would then put that cover over it and just wash that a few times, a couple a day. I would rotate.
That's a great idea. I don't have kids, so I don't know about that.
When you have babies, they tell you to use those sheets, but what we would do on the crib mattress is do 3
Yeah,
or
you
4
just pull it up.
layers. So in the middle of the night, the kid pees
Oh,
through.
you just pull it
you
off.
just peel it off. The kid
Great
goes
idea,
back to
Janet.
sleep, and it's a stupid trick, but it
So
works.
true. I used to do that in like my kitty box, like my like travel, what you put your cat in to go to the vet, right? I put a wee wee pad at the back. 'Cause
Yes.
A lot of times they pee because they're nervous and stuff like that. They just pull it out and it's nice and clean.
Yeah.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator based called NP, or a hydrolyzed salmon based for dogs and cats called HF.
So please ask your veterinarian about Blue Buffalo prescription diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jameela and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
Now, here's the weird trick. I'm going to teach you the trick. That's a weird one, and it's for fecal
Okay.
incontinence.
Okay.
And
For you listeners, that means poop
yes,
incontinence.
poop incontinence.
Yeah, they're dropping their poop.
Yep.
Making sure.
Yep.
Okay.
So my dog Sam, she had spinal lymphoma, and so she was becoming paralyzed in her hind legs, and that also meant some fecal incontinence, right? And she'd be laying on the floor, and just poop would just flow out. It wasn't like lava, but it was, not good. Anyway, and then it would happen in the middle of the night, and I'd wake up, and then she would get caught in it, and I couldn't go out to the restaurant and come back, and there's poop all over. So I'm just constantly cleaning and I would have my rug, my big red carpet cleaner thing out all day. Anyway,
Yeah.
here's what saved Sam months, because I was probably at the end of my caregiving budget. I got a Q-tip, and I brought her outside. And I placed that little Q-tip, just the little cotton swab, in her butthole, in her rectum. I'm trying to be like for general people, right?
Yeah.
And then you just do a little swizzle, a little tickle, and it instantly made her go to the bathroom. So it stimulated her to
Make
go.
them
And then
go.
she went, and then I cleaned her up with a little wet wipe, which, by the way, they have wet wipe warmers in the baby store.
Baby
so you
wipe.
get a warmer, so it's nice and warm also. So then I would wipe her little booty off and inside, and she'd be done. Before I went to bed, if I woke up in the middle of the night, I would always do the Q-tip. And we use that technique for paralyzed pets, and also before going in long travel, you let them pee. So if you've got to crate your pet going on a plane, or if you're a show dog, you don't want them pooping in the middle of the ring. Yep.
No kidding. They do that. It's like the Miss America pageant. They take all that stuff to have no flat stomach.
Well, I know, but yeah, okay.
I mean,
It's kind of the same. I didn't know they
Not
did that
not
with
exactly at all, but okay.
Janet, they take laxatives, like,
right, but it's for a glam moment.
like
They
milk
want
of
the dog
magnesia
It's
or
a
poop on
glam
the
something.
moment.
show.
And that
Oh
so
my
that
God.
saved me a lot of stress is waking up to poop.
Can I ask you, Mary, what breed
She
was
was
Sam?
an Anatolian shepherd.
Okay, because
No
I
idea
had a
what that is.
golden with spinal lymphoma
No
as
way!
well.
Okay, so Janet, that dog, my dog is like a white version of her dog. So like,
Yeah.
Oh,
yeah. So
beautiful.
what happened with her? She started to get the classic signs of weakness and like slumping down in the back, and she would walk on her toes.
Yeah.
For people that it's this
Yeah.
proprioception issue where they would just like have their toe rolled over on their toes. Anyway, I thought for sure this has got to be degeneromyelopathy, which is a
Right.
horrible disease, and it's just a disease that we say it is when everything else has been ruled out.
But it ain't cancer,
right.
thank God.
It's not
But,
cancer.
yeah.
So though I said to a friend of mine who's a neurologist, I said, I want to get her MRI'd. And that's not normally what people do. You've got a 12-year-old dog, you're probably not going to MRI them, right? But I just said, I just want to
Right.
see. So I MRI'd my whole dog, and we found spinal lymphoma. So it presents the
Same
same
here.
way as DM.
Yeah.
But it degeneromyelopathy, and it doesn't change. Well, it did change how I treated her because I did do radiation, but it wouldn't have,
Can I ask you, how much time did that buy her?
Well, so I did radiation and chemo, and so let's see. I think we started that in the summer. So we started that summer, and I said goodbye to her on February 14th on Valentine's Day.
Oh, wow.
So
See, mine presented like when she was walking, the butt she walked like a model, like
Yeah.
feet, but she had great proprioception, and we MRI'd her, and it was a spinal tumor.
Isn't it interesting? Like like you wouldn't know it, and most people aren't going to MRI it, right? It's expensive, it's scary. So
No.
but it didn't.
Yeah.
I did do the chemo and the radiation, and I'm glad that I did. And that's a whole other story, right? But my point is though, she was pooping all over, and then the other thing is.
Well, now what did you?
Go
ahead.
Because of all her fur, so she is like a white golden retriever.
Yeah.
I did a sanitary shave, so she got a whole her butt had like a Brazilian.
The poop shoot.
Very important, because Mary, as a vet, you and I would agree, and Janet, this is going to make you sick, but these long-haired dogs, especially in August, September, you get maggots back there. You
I know,
get
you told
a
me that.
little piece of poop that's stuck by that hair by the rectum, and then flies come and land on it. And as a pet owner, they don't pick up the tail and look, but as a vet, we pick up the tail, and there's all these maggots.
Oh my
back there.
God.
So it's very important to keep
Totally.
that clipped, but not too close, so as to create killer. But Mary, now what about mobility issues with Sam? Did you have to do any
God,
lifts
yes.
or
So
anything?
my whole place got covered with
Okay.
yoga mats, the whole place. And then my favorite,
Okay.
and I get no kickback for this at all, but I wish I did.
Okay.
Because I say it all the
Yeah.
time, is the harness called Help 'em Up harness. So help
Help 'em up.
harness. And there's so many reasons why I love this harness, but it's got a front end and a back end. It's very padded. It has a lot of hooks and things, so that way it's got like longer strap, because I'm tall, so I needed a longer over shoulder strap, which helps, kind of distribute my weight or her weight on me better. She could wear it 24/7, although I did take it off every day, check for any like sore spots. I had to keep it on her though, because in the middle of the night she'd get stuck somewhere, and I could just pick her up and set her right.
Oh.
Bless her little heart. So I'll send you a picture of Sam. Oh, I might have. I can't. No,
You did. Is the harness turquoise?
I don't know if I
Is
sent
it
you
blue?
Sam. I think I sent you Smudge was another one, but it's the same harness. And yeah.
Okay, we'll show
It's
that in the
the
notes.
best
Yeah.
harness out there. It's probably like $100. So it's not the cheapest, but it to me is the best, and you could wash it and stuff like that. So
And so you can use that for degenerative
oh
myelopathy?
my God, yes. Like it is, you need to
Okay.
get one. Or the other disease that's one of my, I don't think a disease should be my favorite disease, but it's a favorite disease of mine,
Yeah.
is GULP, which is
Yes.
geriatric onset laryngeal paralysis and polyneuropathy. So GOLPP.
Jeez.
And that I have a website called All About Gulp, because my Doberman, the one that had the heart disease, he also had gulp.
Oh,
And the gulp is not what took his life; it's the heart disease. But so anyways,
oh,
Duncan had that, and so any dog that's got mobility issues, whether it's a disc disease, it's arthritis, it's a neuropathy, it's extreme sarcopenia, which is muscle wasting, or cachexia, which is muscle wasting in the face of a disease. Like you got a weak and a wobbly, spaghetti legs, pop a harness on them all day long.
Blue Buffalo Natural Veterinary Diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well pet and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo Natural Veterinary Diets.
Hi everyone, I'm Larry. Some of you know me as Grandpa Larry, and I run Larry's Animal Safari on YouTube, where we share sweet and educational videos about baby gorillas, zoo animals, and the amazing teams who care for them. If you love animals of all kinds, I'd love to have you join us. You'll meet little ones like Jameela and Kayembe, learn how zoo families grow, and enjoy real moments that bring joy and curiosity to animal lovers everywhere. Just search Larry's Animal Safari on YouTube, or click the link in the show notes. New videos go up weekly, and each one supports awareness for animal care and conservation. Thanks to Speaking of Pets podcast for all they do. Now, let's get back to the show.
what about for some of these renal failure, like my Capri, these kidney failure cats? They get real skinny. Some of them don't want to eat because they're so uremic. They're sick to their stomach. We know there's meds for that, but I would also take her outside. She loved the sun, so we'd sit in the sun. You've got to give them emotional therapy as
100%.
well.
Enrichment is so massive. And think about a cat. If they were in the wild, they'd be clawing at a tree. They'd be looking at a lizard, right? They'd be doing these things. So you've got to stimulate their brain also, for sure. And people underestimate how bad nausea feels. And I attempted to climb Kilimanjaro in October. And so I got to a little over 15,000 feet, but I spent 2 days vomiting all over that darn mountain because
I'm sick to my stomach hearing it.
I got altitude sickness, and it was horrific. I couldn't keep anything down. Nothing tasted good. I was getting weak. Water was, and so nausea is a type of pain, but we don't think of it.
Yes,
So
it
there are
is.
3 types of pain. There's pain like arthritis, like the sensory pain. There's pain from feeling like crap, right? Like nausea, end-stage kidney disease, end-stage liver failure, like, even swelling, right? Like if you've got ascites or like swelling from some of your diseases, edema. And then the third is anxiety, right? So anxiety is a type of pain.
Yep.
And if you're nervous, with cognitive dysfunction, or you're peeing on yourself, like all these things of just the anxiety is just another form of pain, and we should not underestimate it.
So true. And especially since there's meds for it.
Totally.
I had a kidney stone and they took me to ER. They didn't know what it was. Okay, then they said, and I said, oh gosh, I'm so sick to my stomach. And they gave me something. And I have to tell you, the pain from the kidney stone was still there. But relieving the nausea made me feel so much better.
Here's the thing. I always think, actually, even though I said it's pain like sensory pain, then disease pain like nausea, and then anxiety, I think it's in reverse order of suffering, right? So to me, and now I'm going off a tangent, but if you think about what's the difference between pain and suffering, and suffering, to me, my definition is that when I can't think or do anything else but concentrate on the pain that I am in, whether that's physical or emotional, that's suffering. And my sacrum, that's painful. But I'm not suffering. Nausea, anxiety, that's suffering, because all I can think about is, oh my God, my mouth is watering. Here it comes again. I'm going to throw up, and I'm nervous because I'm going to have to, get on stage and do a lecture or whatever I'm nervous about. I don't know, taking a test, whatever it may be. So I think I think we underestimate suffering and what that means. And no one wants their pet to suffer, but we don't even know we don't even define it. And to me, some of these pets
Right.
are suffering and we just don't realize it. And did you know that 50% of pets have not been to their veterinarian the year before they die? And that year is that geriatric phase where we could be doing so much, where we can give them anti-nausea medication like you had, Dr. Alice, right? We can give them pain management. We can give them anxiety meds. We could teach the parents how to wipe their maggot butts cleaner, right? We could teach them all these things, but they don't go to their veterinarian. So 50% have not been.
Well, and I think there's a couple reasons. I think the owner doesn't want to qualify that, oh my God, he's dying, or maybe something horrible's wrong. But secondly, that's where in mobile practice, I think means the world. When I was in general practice, I loved going to elderly pet owners' homes because some old people, and me included, I've got 2 rescue Goldens. I can't lift these dogs and put them in the car.
No.
So it was important to me to have a vet come to the house, which unfortunately we're getting away from, which I think we need even more. But sadly, I think there's reasons for that.
There's
which is sad.
I'm going to say another one, and which is why Lap of Love, we're successful, if you will, because we do in-home, right? We are in-home hospice and euthanasia. So, but these people need us way before it's time for Lap of Love. Like they need veterinarians before Lap of Love, right? So the other reason why a lot of families aren't bringing their pets in, and there is, by the way, zero judgment when I say this, like zero judgment.
Yes.
One is they just don't know, they don't understand, or they may not, their cat's not coming out. Well, he's just getting old. No, there's a lot of stuff that's brewing, and I think if they knew, they might do something. 2, it's difficult physically to get them in, like you said, and 3, and this is no judgment, but we know they're older and we know time is limited. So how much will somebody spend financially, emotionally, time? Yeah. And I get it. Right? And I'm not, by the way, I am not comparing my animal to a car at all. So please, I don't want any hate. But I have my car is from 2013. It's 12 years old. It's a Ford Explorer. I love this thing. And it's at the shop right now because it's got to get a motor fix for its sunroof. And everyone's like, Mary, why are you spending another $1,000 when, you should just get a new car? And I'm like, but I love this car. But I think, wow, right. It's kind of... And some of the things we have to do, why did I do an MRI on Sam? I mean, that was $1,500.
Because we have to know, because we might be able to do something.
I wanted to know. And I was able to afford it, and I did. But a lot of people, you're struggling. Did you know 50% of the population, the human population in America, do not have $1,000 in savings? And so you've got to feed your family, get gas in your car, go to work. You're making... maybe 40 grand a year, if that, plus supporting the child. Yeah. And now you got to do $1,000. For a dog that could barely move and is crying all night. I get it. I get it. However, there's also some very economical things that we can do to make them comfortable. Really economical things. And whether it's not the $100 help them up harness, we could talk about a different harness that's cheaper, right? So there's so many things that we could talk about that won't stretch our budget too much.
What about?
I think it's okay to compare to a car because when our mom lived till 92, and I think she was 92, and she said this to me. She said, and she was really pretty healthy actually for her age, quite mobile and active. And she said to me, "I just feel like an old motor in a young chassis." Because her inside, her internal organs were shutting down, right? Yeah. And I remember saying that, and I'm like, that must be so frustrating.
Yeah, I think it is. I think it is.
To feel that way. You want to go, but you can't.
Yeah, my sister's mother-in-law, she was in her 90s also, and she would read the Wall Street Journal every day. She had zero cognitive dysfunction, and her husband did, and I remember talking to her, and Adlin was her name, and I was like, Adlin, you're sharp as a tack. And so she's like, that's not always good at my age, because I know. Right. I know, and I know, and that bothers me more. I'm like, oh, snap, right? Wow. I'm like, ignorance.
But can
You
we
know,
go back to talking about pain? Because how, like, what are the signs that my pet
Oh
is
gosh,
uncomfortable?
it varies, but we could give you a whole long list, right? It could be from panting and pacing. It could be from licking.
Right.
If you've got salivary stains on a joint, maybe there's some arthritis there. There could be some lick granulomas have been, kind of looked at pain.
yeah.
Fur standing up on their back a little bit differently, right? Even petting them,
Oh,
like you'll see muscle twitching, like you'll it's
like it's
uncomfortable.
uncomfortable.
Things
Yeah.
that shouldn't hurt, we call it allodynia, which typically shouldn't hurt, now hurt. So like petting them,
Oh,
even the air
yeah.
blowing on them. In human hospice, sometimes they have to turn the air conditioning off from blowing on them because that hurts, right?
Yeah.
I'll go to euthanize a pet and we use a tiny little needle for sedation and they'll be like, ah! And I'm like, whoa. It
Yeah.
shouldn't hurt, but they're heightened.
Yeah.
They're so
Sensitive.
sensitive. Their threshold is now like they're beyond their threshold, so everything hurts. I suffer from
Yeah.
migraines, and I say suffer because when I get one, I'm not thinking anything else, right?
Oh,
So I get migraines, and it's
Yeah.
like you don't touch me. I don't want the lights on, like all those
right.
things. So, changing their behavior. So the cat that's not going to the sunny spot, that's maybe not eating. They may not be eating because they're nauseous and have a disease, or that food bowl is down so low and it hurts my neck to stretch, right?
That's what I
Oh,
wanted you to bring up about food bowls
Yes.
and raised food bowls, and what are some
Okay.
tips for that? Because
It
that's
is,
so
but what I want
important.
to do instead of just raised, because sometimes you're just raising them and now they got to
Yeah.
lift their head over the bowl, is so you don't want them too
Okay.
high, but have them tilted. So there are tilted ones that you just kind of roll right into. So you
huh.
just kind of just like a food truck.
I've seen those,
Yep.
Janet, on Amazon. Yeah,
I
and
haven't
chewy.
seen that before, so it's kind of like
Yeah,
up
you're
and
up
at
and
them.
you just go
Yeah,
right into it. Yep.
yeah. You don't have to
You
go
don't have to go
into
into
it
it.
like that.
Exactly. See, there's a million.
Oh,
This is why I wrote my book, is because my books, because I have all these little tips and tricks, and it's not. We don't have enough time in the vet hospital to talk to families about all these things.
Right.
This is a long
yeah.
conversation. My mom, she's 80 and she's a jalopy right now, and I just got her concierge medicine, and it's with a physician's assistant. And it is the best thing. So it was just last week. She sat down, she talked to this guy for 45 minutes. I was on FaceTime. She talked about all her, and she's like, I feel like a human. You talked to me for so long.
Oh,
Because she's like, I
Oh,
go to these doctors and
no.
it's 15 minutes, and I said, yeah. And when you've got this
yep,
long laundry
I
list,
know.
yep.
and you know what? So one of the things, she needed a hearing aid, and so the hearing aid person, whatever doctor, audiologist,
Audiologist. Yeah.
they didn't take the
Audiologist, yeah.
time to realize that
Yeah.
her hands had so much arthritis she couldn't do the little knob to change
Oh,
so she's like, I can't wear this because I can't
Oh,
change the volume, right? I'm like, oh my god. So now her concierge doctor is all over this, and it's just
now they have one you can do on your
correct,
phone.
right? Well, then they got to get it on the
You
jitterbug
right.
can
because she
adjust on
doesn't
your
like the
phone.
iPhone. She needs jitterbug.
Yeah.
I
I think they just like the
I
name
know.
of
I said,
it.
Mom, they're just marketing
No.
for you. I got her an iPhone. I
Yeah.
took everything off her phone except for email. No, sorry, text message and phone. And she's like, it's too much. I'm like,
Right. But Mary, that's important because when I had elderly pet owners, I
yes,
had to watch. You couldn't really have them give the cat a teeny tiny pill because their
Mm-mm.
arthritic hands. You
Yep.
really have to stop
yep,
and think about this. Can this pet owner medicate this pet? So it's not only what the pet needs for medication, is can the owner give it?
girls. I tried to look at a shampoo bottle yesterday to read, and I'm in the shower. I'm like, good God, can they make the font any smaller? Right?
And you can't put your cheaters on in the shower.
It's funny you said that because I was looking this morning at the same thing. My hairdresser gave me this serum for my hair, and I turned it over to look, and I'm like, holy cow, who could print that small?
Wait, I just did it today with some synthetic caulk I was using to patch a what do you call it, a bird
Patch
bath
it up.
outside.
Yeah.
And I'm looking, I'm like, well, how long is it supposed to dry? I still don't know.
I have to tell you, I read a story one time about human physicians and their relationship with patients, elderly patients, that, okay, the goal of treating them is not to make them be able to walk around the block. The goal is to say to that patient, what is it that's most important to you on your daily activities? And this gentleman, the patient, said, I really like to be able to go and buy my lottery ticket and a coffee every morning. And you know what the doctor said? I can make that happen. I may not be able to have you jog around the block, but I can give you some meds to make you comfortable enough. So sometimes we overthink things. It's instead of the little appreciative daily routines that pet has. Like he enjoys eating. Okay, but I have trouble getting him to the food bowl. Let's carry him over there.
I lecture a lot to veterinarians also, and I say, when you've got these jalopies in with you, you have to ask the family two things, like, what's your biggest problem? What are you managing? And what are the joys of living for your dog now, right? And what are is it just ripping up the newspaper? Then give them the newspaper to rip up or whatever, right? But what is their biggest struggle? Because as veterinarians, we might be looking at that teeth that are just disgusting, and we know that we should be cleaning those teeth. I don't even care if they're an old dog and I'm going to put them under anesthesia. Like, I know they're going to feel better, they're going to eat better. I know these things. But if that dog is panting and pacing all night long and nobody in that house is sleeping, I got to hit that first. Although the teeth might be causing it, but I got to get them sleeping. Every sleep, quality of sleep is so important. It's medicine also. So I asked if nobody's sleeping at night, let's hit that first. Then they come back.
Sleep is underrated. The value of sleep is completely underrated.
It's restorative. It's reparative. It's all these things. It's so good. But then, you know what? In 2 or 3 weeks, when they've got some good night's sleep, I'm going to talk about the teeth then, right? Like, because I'm not going to hit them up.
When
they can handle it. Like, they're not going to spend $1,000 to get the teeth cleaned if they can't even sleep at night, right? They're going to be like, heck no.
Speaking of that, Mary, what about some of these old dogs with cognitive disorders that are up all night pacing? The sundowner syndrome. Any tips for that?
This is the disease I hate. So I hate this disease because the statistics are alarming. Like 50% of dogs over the age of 10 have it or something like that. Don't quote me on that, but it's crazy. Tip number 1, see your veterinarian way sooner, because the sooner you catch it, the better. It's little signs like, looking, like getting stuck in the corner, or going to the door and not going to they go to the hinged side because they know the door's over there, but they're confused. It breaks your heart. The sooner the better, because there's so much good diets and other supportive things. By the time they see Lap of Love, which is hospice, I'm getting them to try to sleep at night on like Xanax and Valium, which is not, like, I want them supportive, and because you could be years like this, and it's cats at 2 a.m. Like it's right. So the other small thing is, anytime you see cognitive problems, always check for urinary tract infections, because they will exacerbate the signs in humans and animals as well. So a lot of times they are not incontinent, or they're got the maggot that's dirty down there, not getting clean. The cats can't groom themselves. They're more prone to UTIs. Check that, handle that, and sometimes it'll decrease it. But there's a lot of good stuff that your veterinarian can prescribe that help you early on. And enrichment. So when you go to a nursing home, they want you to play canasta and all the games. Play games. Bring them outside. Bring your cat outside to sniff the roses and chase the lizards with a leash.
Yeah. Isn't that interesting you said about UTIs? Because so many elderly people have UTIs that they didn't even know they had.
And it affects their Alzheimer's. It makes them worse. You handle that, it won't cure it, but it will decrease the symptoms. And a lot of times too, they forget to go to the bathroom, so they're holding it longer. So there's all these things. It's amazing. There's a great book by Atul Gawande called Being Mortal. And if you're into this kind of stuff,
read it.
It is
wonderful.
I have so many books on my bookshelf, I never read them all. But this book I've read like 5 times.
Yeah.
Atul Gawande, Being Mortal. Like,
It's wonderful. I think I have
It's
it back here, seriously, because I saved my
yeah,
favorite
it's
books.
phenomenal. I'm looking at
Yeah.
like I love this book.
Yeah. Yeah.
So, Dr. Mary, we got to ask you our question that we ask all of our guests. What is your pet or human peeve? Like, what gets you? It can be about humans or
Yeah.
pets or cars,
You know, it's probably more
jalopies.
humans because pets don't get me too much. Like I love a pet. You know,
Right.
I can't imagine like
Do you know how many veterinarians say that to us? They always
yeah,
give a human one.
yeah.
Because we love what
Okay.
we do.
Can I give
I
you
know.
two that really annoy me?
Yeah.
Yeah.
Okay.
Knock yourself out.
I can't stand when people talk on their cell phone on speaker in public, and they're not.
Oh, that's Alice.
Alice does
That's
it?
Alice.
Never
You
do
talk
that.
on your phone in speaker.
Because I can't hear.
That earplugs or whatever.
She does, and then she's like, da, 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 da.
It's
Oh my
so-
God.
I
Yeah.
don't
annoying.
do that, Mary. She's making it up.
Next time I'm going to call you, Alice, put it on speaker, and I'm going to talk about my rectum.
Fine with me. You can talk about any
Oh my
orifice
God.
you want.
All right, the other pet peeve of mine is when I'm on an airplane and people
Oh.
don't let the row when you're exiting the airplane, let the people in the row go, and they like come, you know, like if you're in row 5 and row 6 is trying to push out, back up, let me out first.
But you know what pisses me off?
I,
is when
Janet,
those-
I know you're going to tell this.
when the row's ahead of you, I'm like, I'm waiting, and they're putting
Okay.
shit away, and I'm like, that's it, I'm going, because I'm prepared to exit.
No, I thought you were going to say the last time Janet flew out, she said she was sitting next to two elderly people, and she said, everyone's getting up ready to go, and these two people are just sitting there, just wait. That
I
drives
agree.
me nuts, too. It's like, get
Yeah,
up.
I'm
get up. I want to
I'm
get
ready
past
to
it.
go. Ding! I'm up. I'm going. Everything's
Yeah,
packed.
I'm
Let's
with you
go,
on
people.
that.
And they're still
I'm
farting
with you on
around.
that, but here's the thing: is that I'm also ready, so I'm ready to go, and I'm a window girl, right? So I've got to wait. I'm a
Me
window girl,
too.
so then my aisle person goes out, and then here's the row behind me, and I'm like, back up! I'm ready to go.
That's right. Where did you
I
come
just
from?
mow them over. If I'm ready to go and they're dicking around, I'm out of there.
You and your sister on her cell phone on speaker. I can't travel with you guys.
That is not true. She's making that up. I'm telling you right now,
You
Mary.
do. You talk on it like this instead of like
Put
this.
it to your head,
First of all, I'm hardly ever on my cell phone. I'm hardly ever
right?
on
Because
it.
it's in your hand, and you're just talking to it. You know.
This has been an absolute pleasure.
Janet,
and I've
I
learned
told you
so
you would
much.
love her.
I know.
I'm telling you, Mary, after I listened to that webinar of yours, I was on my thing emailing you because it was so, I learned so much, and we're going to put some of those photos of helping things on the podcast text, and also the Help 'em Up harness thing, and your Amazon
My shopping page and
shipping
then my
page.
book, which I think my books will
Shopping.
be really helpful for pet owners.
Yes.
They're
And Yoga Mat Direct.
yogadirect.com.
Yoga Direct.
And I do have to add one more thing. When I was in practice, I had seen like people with their third generation of pets. Well, by then they're like in their 70s or early 80s, and they're coming in with a 12-week-old
No.
yellow lab. Let me tell you, folks, as a 71-year-old person, I normally adopt old dogs that nobody wants, okay? Because I enjoy older pets. I've got these 3 and 4-year-olds, and I've looked at my husband and said, I don't know that we can do this. So just keep in mind, yes, you're young in spirit, but physically, a 12-week-old lab when you're in your 70s or 80s
No.
is tough.
I only adopt seniors,
So.
and I really would only adopt geriatrics now.
I love
like,
that.
honestly, because I'll take 2 months of love.
Yeah.
And it is unconditional. It's so amazing. It's lovely.
Oh, it's so
so rewarding.
rewarding to help them through their journey. Oh,
You know,
I love it.
I'm on the advisory board for the Gray Muzzle organization, and it's a
Oh.
non-for-profit that raises money for grants to go to shelters and rescues for gray muzzle, dogs. And so I'm on the grant approval group. And so every spring we look at grants from shelters and rescues because they're asking for $5,000 or $10,000 or whatever. And I like cry reading it, and it's lovely though because they talk about all the senior dogs in their care, and the number one problem that they struggle with is dental care. So they all got dental disease and need their teeth cleaned. 'Cause who wants to adopt a dog with a hot garbage breath, right?
Yeah, you're right.
Yeah.
You're right. And I think a lot of people don't want to adopt seniors because they're afraid of
Yeah,
the
right.
expense. And they don't want to lose. I can't go through
They
this
don't want
again.
to lose them. Yeah.
I know, but it's not about you.
Yeah.
It's about giving that dog or cat for the few years they've got
The
left,
best.
treating them like
The
a
best.
king or
You know what? You'll
queen,
save
you
money
know?
because a puppy's going to chew your shoes, right? So let's do it.
Oh, I know. The 3-year-old does that.
Save
Yeah,
money.
yeah. And I don't care about the chewing. It's just that I feel badly that they have anxiety when I leave, which I never leave, but on occasion when I do, yeah.
You did a great job. This has been really informative. Thank you so much. It's a
Yes,
pleasure getting to know you.
and listen, we're going to close it out. So this is Dr. Alice Novotny-Jeroman saying goodbye for now, and Janet.
And Jana Novotny King saying thanks for listening. We appreciate you. And don't forget to send us your questions. We love hearing from you. Love your pets a little more. Give them an extra biscuit from us. And we're the Novotny sisters from Cleveland, Ohio. Thanks for joining us.
Bye-bye.
Bye.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.